Welcome everyone, calling to order the Boulder County Board of Health regular meeting, February 12th, 2024 is 5:34. And we're going to have board members who are present introduce themselves, please. So Morgan McMillan, board president. Amber Johnson, board member.
Brooke Harrison, board member.
Item number 1 is public comments.
There are no public comments.
Item number 2 is approval of the January 16th, 2024 regular meeting minutes.
This is Brooke, and I move that we approve the minutes.
All in favor?
Aye.
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 Minutes are approved. Great. Item number 3, staffing announcement.
Good evening, Board of Health, guests and staff. My name is Jordan Thomas. I'm the Business Operations Manager at UHD, her pronouns, and I'm super excited to introduce Patrick now to his first official Board of Health meeting. Patrick started last Monday, and he's already been to a board retreat, extensive staff meetings, and now his first Board of Health meeting. So I'm really excited to have you here.
In this role?
In this role,
Yeah.
yes.
What is this?
Oh, sorry, yes. You want to go for it?
You go
Yeah,
ahead.
okay. So Patrick is our administrative assistant within the Administration and Finance Division. So he supports just the business operations team as well as our directors team, and like other agency-wide initiatives that we have going on, helping with the board. And he has lots of projects lined up that can just help further our streamlined efficiencies. So it's really exciting to like have another person to brainstorm with. Exciting.
Been a great first week. Thank you, everyone.
Where to work?
Yeah.
Okay, item number 4, divisional spotlight sugary drinks recognition.
Good evening, Board of Health members and honored guests. My name is Christina Edstrom, and I'm on the Healthy Eating Active Living team at the Boulder County Public Health. So this evening, we will be honoring the collaboration between Louisville restaurants and 2 community organizations. And do we have the slide? Great. All right, next slide, please. Right. So unfortunately, poor diet has eclipsed both tobacco and high blood pressure as being the #1 cause of mortality, according to the World Health Organization. Next slide, please. In a society awash with highly processed food, sugary drinks are amongst the worst, being the #1 source of sugar in our diets and the #3 source of calories. Next slide, please. The average American adult consumes 60 pounds of sugar a year, the equivalent of 6 bowling balls, while the average U.S. child drinks 40 gallons of sugar a year, which is enough to fill a bathtub. Right. Sugary drink consumption is linked to several health conditions. 1 sugary drink a day increases your risk of heart disease by 33%, 25%, risk of too much weight for health by 55%, and kidney stones by 23%. There's also growing evidence that soda is implicated in colon cancer and mental health disorders. Next slide, please. The U.S. is expected to see a tidal wave of diabetes. 1 in 3 kids born after 2000 is expected to develop diabetes in their lifetime, and unfortunately, the risk rises to 1 in 2 for children of color. Next slide. We're already seeing diabetes increase in kids. Prediabetes more than doubled in U.S. youth in less than 20 years. Next slide. For all these reasons, we believe sugary drink reduction strategies arguably warrant the same urgency today as cigarettes did 50 years ago. And we're up against a lot. Sugary drink companies continue to spend over $1 billion a year on advertising. Right? Worse than not consistently, they tend to target groups that have a higher rate of disease. Next slide. Fortunately, there are passionate groups of people here in our community who are working to reduce sugar drink consumption. The Healthy Louisville Kids Coalition is made up of representatives from these organizations and other organizations, as well as local health professionals, restaurant owners, and parents, and is advised by Louisville Council member Mark Hamilton. Just Add Water, Youth Committee made up of Boulder County youth worked across Boulder County to inform their peers and the wider community about the harms of sugary drinks. Next slide. They had information booths at community events, gave testimony to decision makers. Next slide. Created social media campaigns, educated elementary school kids about sugary drinks and so much more. Next slide. But one of the most successful endeavors they worked on has been asking locally owned Louisville restaurants to not list any sugary drinks on their kids' meals. This is an effective strategy because families are eating out more than ever, 4 to 5 times a week on average. And we know that healthy defaults work. Families choose the healthy option 67% of the time on average. Next slide, please. The amazing Louisville restaurant community stepped up to the plate to make a difference. 86% of locally owned restaurants with kids' meals signed the pledge. Next slide, please. Tonight, the Board of Health in Boulder County's Public Health Director will honor the following restaurants and coalitions. Next slide. And unfortunately, this is a time when a lot of restaurant owners are very busy, but some of them gave me some quotes. So the reasons that they're signing have been really inspiring. Murphy's owner, Adam Perkins, signed the pledge in honor of his brother, who was diagnosed with type 1 diabetes as a kid. He talked about remembering how difficult it was to go out to eat with his family growing up. Kelly Nichols, who is the co-owner of John's Table, said, "We support removing sugary drinks from kids' menus because nurturing young bodies with wholesome nutrition seeds a lifetime of health habits." Next slide, please. The effects of this collaboration can't be overstated. If the average child in Louisville drinks water instead of soda every time they dine out, they will avoid 21 cups of sugar and over 16,000 calories a year. So thank you all so much. And now I will turn it over to Morgan to hand out some letters.
Great, well, thank you. And I'm gonna read the letter out loud and then we can distribute it. Thank you for your staff leadership on the program. And on behalf, and this is to all of our guests over here. So on behalf of the Boulder County Board of Health, we want to thank you and acknowledge you for your commitment to making Louisville a healthier place to live, especially for the youngest residents. Your strong dedication to the health of Boulder County community members is greatly appreciated. The health and well-being of Boulder County residents, especially our children, is a primary concern. Children who drink just one sugary drink a day are more likely to experience diabetes, heart disease, cavities, non-alcoholic fatty liver disease, kidney stones, and depression. The American Academy of Pediatrics recommends that children consume less than 6 teaspoons of added sugar per day. At the average child-sized restaurant, sugary drink contains 8 teaspoons of sugar. The average child eating out the average number of times per week and drinking an average size soda consumes around 21 cups of sugar a year in those restaurant sugary drinks alone. Therefore, the collaborative efforts between the Healthy Louisville Kids Coalition, the Just Add Water Youth Committee, and the restaurant owners who have committed to not offering sugary drinks with their kids' meals are to be commended for their direct impact on the health of Louisville children. We honor and thank you for your work. So thank you so much. And thanks for your leadership in the community and working on this. I have a whole stack of letters, which I don't think I have. I don't know if I'm just not sure where to start.
I can just winnow through them.
Okay.
And see who's here, if that
Great.
helps.
And then we'd love to get everyone for a picture. Okay, great. So Barbara, you're here. City Council member, thank you so much for your leadership. And Zimmer, come on down. Thank you. Thank you. Okay, and David Banner.
Sorry, there's a lot of people involved with this, so
Yes.
that's true.
Awesome to see all the partners. Absolutely. Great, I gotta work on my glasses here. Raghav, did I say that name right? You got it. Thank you so much. Oh, sorry, no, that's okay. Tyler, come on down. Thank you. Thank you. And Seth, Dr. Seth. Yeah, thank you. Do we want to do a group picture?
Yeah.
Is that, yeah?
Would you all like to come up? You can go.
Should we do it?
Yeah, we got this.
Yeah, thanks, Sean.
Your toes.
Nice, yeah.
Board members come in here, we can spread ourselves out a little.
All right, squish together.
Like move.
There you go.
You want to just take it in front?
I'll come out in front, like the.
A couple of people.
Yeah.
We'll go here.
Yeah. Aw.
All right, you ready? Just begin a little bit. There we go. That's perfect. One. There we go. Thank you. One more slide.
Oh, okay.
Yeah. I'm happy to share these out if anybody wants.
Thank
Thank
you.
you so much.
Thank you.
Yeah, I think your name's there.
Landry and Brooke are both on.
Maybe we can. You all, do you want to add, we do an introduction for the?
I got that.
We're good.
We, yeah, I do have it. I guess until you take it.
Okay, thank you again to all of our community champions. Item number 5 is the 2023 year in review.
Okay. Oh, wait.
So our communications manager, Sean Hollister, has put together a little video, just hitting some of the highlights of 2023 for your viewing pleasure.
Got you popcorn. You ready?
Say.
Okay. All right, here we go.
After more than 3 years responding to the COVID-19 pandemic, Boulder County Public Health is getting back to serving the needs of the wider community. We've increased the capacity of our staff, stabilized our leadership, and we've set a strategic plan for the next 4 years. Let's take a look back at some of public health's accomplishments in 2023. After a robust recruitment and interview process, Public Health promoted Dr. Lexi Nolan to the role of Executive Director and Dr. Indira Gujral to the role of Deputy Director. 2023 was a busy year for the Board of Health. The board said farewell to Greg Thomas after 11.5 years of service to the people of Boulder County. That led to the recruitment and onboarding of the board's newest member, Amber Johnson. The Board of Health also assisted with the recruitment and appointment of the new executive director, held retreats with the county commissioners to increase collaboration, and reviewed and approved the county's new public health improvement plan, community health assessment, and an increase in fees associated with on-site water treatment systems. Administration and Finance Director Catherine Palmer was elected to serve as the Vice President of Colorado Public Health Administrative Directors. As part of a division refresh, the ANF team used lean methodologies to analyze over 400 processes and streamline their work by roughly 20%. The team also successfully planned and managed the complex launch of Dimensions, the county's new timekeeping, payroll, and benefits system. The Community Health Division was awarded a Pinnacle Award from the County Commissioners. Pinnacle Awards are given to staff for programs that best represent Boulder County values. The A La Raiz to the Root program earned the Commissioners Pinnacle Award for engagement. The team held workshops and gathered feedback from over 100 of the county's young people on issues related to mental and behavioral health. The Genesis and Generations programs received a grant from the Colorado Community Health Alliance's Community Incentive Program for their innovative work in connecting children, youth, and family to preventative health services. Division Manager Heather Crate completed the Association of State and Territorial Health Officials Leadership Development Program, Diverse Executives Leading in Public Health. The Environmental Health Division's Healthy Eating Active Living team worked with passionate local youth to create sugary drink reduction projects, including public events, social media, working with local businesses, and writing new menus. The HEAL team also spent a day with a health policy journalist from National Public Radio and helped highlight Boulder County Public Health's Fruit and Veg program, which serves families experiencing food insecurity who are unable to qualify for federal food benefits. Leaders from across the Environmental Health Division are assisting with the coal ash cleanup at the Valmont Power Station by providing regulatory oversight of remediation and facilitating community education and engagement. Working in partnership with Health and Human Services, the Environmental Health Division supported the residents of La Luna Mobile Home Park to purchase their park, and as a result, 34 low-income households now have permanent and affordable housing. The Nurse Family Partnership's Bilingual Infant and Early Childhood Mental Health Consultants Program was awarded 2 Pinnacle Awards by the Commissioners, one for Resilience, which is given to programs that focus on preparing the county and community to be better prepared for future challenges, and the Commissioner's Choice Award, which is given to programs that capture all of the county's values and exemplify the absolute best in public service. The Family Health Division's Family Connects program fully launched in 2023, resulting in over 400 nurse home visits to postpartum parents. The Family Voice Ambassadors Group was created in April 2023 to ensure the voices and experiences of marginalized caregivers are incorporated into the operations of Family Connects. The Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, returned to in-person services, including 6 bilingual parent educators who've helped respond to a surge in the number of Spanish-speaking households enrolling in the program. The Communicable Disease and Emergency Management Division's Immunization Program was awarded the Commissioner's Pinnacle Award for service. The team conducted 18 community clinics, often in places like food banks and homeless shelters. When the award was given, the team had administered over 7,000 vaccines to more than 5,000 clients. Emergency Manager Chris Campbell was awarded the prestigious Building Bridges Award, given to individuals or groups who work across political and social divides to solve major issues. At a ceremony in April 2023, staff from across public health were presented with COVID-19 and Marshall Fire commemorative coins. The event recognized the team's dedication to the county's communities and helped bring closure to one of the hardest times in the county's history. The Public Health IT team conducted laptop replacements, installed new credit card readers, rolled out Acela to help teams work smarter, and managed the conversion of a large shared drive to cloud storage. The Public Health Communications team improved their skills and capacity, issued 26 press releases and advisories, responded to roughly 65 media requests, and published over 200 social media posts in English and Spanish. Working with partners, the Health Planning and Evaluation team developed the agency's 2023 Community Health Assessment and the 2023 to 2028 Public Health Improvement Plan. The team also facilitated 6 working groups and gained feedback from approximately 140 staff members while developing the agency's draft 2024 to 29 strategic plan. The team led the development and launch of the Mental and Behavioral Health Project, funded by the American Rescue Plan Act, which provides $1.3 million over 2 years to support prevention, early intervention, and harm reduction. Thank you to everyone who helped make 2023 a success. Boulder County Public Health is looking forward to ensuring that all residents of the county have an opportunity to live a healthy life in 2024 and beyond.
Thank you, Sean, for putting that together.
Yeah, that's great.
Nice summary of a big year.
Hey, Jordan, can I jump in really quick?
Please, go ahead.
Hey, yeah, no, I just wanted to also thank Sean. I know that the comms team has really stepped it up, and then we have a lot of work ahead of us in 2024 and looking at some of our new video capacities as well. So I know that Sean took a lot of time and effort to pull the video together, and I just think we're looking at more of these type of videos that really are able to demonstrate to community and such of some of the work that we're doing. And so, yeah, I just want to personally thank Sean for stepping into this space. I know that's something he and his team were able to turn around this past week. So just want to say thanks.
Okay, thanks for adding that, Kelly. Okay, item number 6, standing agenda item is budget process update. I know we talked, we went into a great deal of depth at our retreat last week, but just wanted to do a quick update as part of our regular meeting. So thank you for doing that.
I am Desiree Kazarosian. I'm Finance Manager for Public Health, and I use the she, her pronouns. So these are a few of the slides that we presented at the budget retreat. And this is the percentage that is remaining in the budget for 2023 currently, as well as the remaining amounts that have not been yet spent down from 2023. A lot of these amounts will be more final at the end of this month. Our accounts payable and our accounts receivable systems will close. We will continue to be processing some changes until our audit is complete, which is not until July, but we will have submitted our trial balance in the later spring. And so, go ahead.
Sorry,
Go ahead, Morgan.
Well, no, I just wanted just like the clarification around the
Yes.
operating amounts that are there.
Right, so there's $2.7 million left overall from the amount that we have budgeted and operating. And the county amount is that PH 13, so that there's 415,000 left in that. And 60% is the percentage left to spend down.
And we're continuing to process invoices and clean up the books and adjust the actuals in the budget.
And will you just remind us, does the 2.7 include our reserve dollar amount? It does not. Okay.
No, these are just operating expenses. The reserves are held in a separate series of accounts. So they are not reflected on this slide. The work that we're doing that Lexi's referring to is mostly, it's not going to change that overall number, but it's changing that bottom county number. So we're shifting things between their appropriations because that was a revision of what the original ask from the county was to just track personnel to now tracking the operating. So my team is working very diligently to get as much as they can get done, mostly this week. So that'll be the big push. Can we go to the next slide, please? So these are the system updates. We continue to work on reclassing their appropriations, which I just mentioned. We are verifying some of the budget details that we had in OpenGov, because that's another area that we hadn't been updating at the county's recommendation that we are now revising so that the budget to actual is looking correct since that information is being used countywide. We're continuing to work for a solution on how to track our indirect, which is an area that is unique to public health that isn't used by the other departments. So we're doing that in collaboration with OFM because it's a new process for them. It has to be something that they sign off on since they manage that system. We're estimating the last week of pay for grants because Dimensions is fully integrated. We're getting some updates that we may have some information as early as this week on some of the information from that last week of this. We're ensuring that all of the revenue and expenditures, all those transfers that happen between the county and public health, we know what the remainders are. And we're participating now in those county dimensions meetings since public health holds a little bit of a different role than the other departments. That we need to be in on those discussions and make sure that we get the functionality that we need as a department. All right. Questions on this slide? Okay, thanks. This is just an overview of the timeline and where we are. Those check marks mark that those items were completed. There are some areas that are substantially completed that are not totally complete that are still showing it in progress on here. So we are in that December to March phase 2 area. Some of those items from December to January, like working on the financial systems, I think they will continue to go across the months as we look for additional functionality or things that we would like. And then phase 2, we begin the strategic budgeting. Phase 3 is the operational budget approval, and then study session and late budget amendments happening in July to December. So those are the only items I had. Do you have any questions?
No, thank you again. I mean, again, we covered this in a great deal of depth last week. So thank you for all the work that continues to be important to us, and we appreciate all the work. Okay, item number 7, planning coordination with Boulder County.
Thank you. I'm Lexi Nolan, Executive Director at BCPH. I use she, her pronouns. And we wanted to provide you with some new information that you might not be aware of. But just some examples of work that we at Boulder County Public Health are doing in alignment with county leadership, either department heads or the county commissioners. And these are just a few examples. I kind of took the top 10 just to kind of start giving an orientation because it provides you with a little bit more survey of how we work across the county. And of course, this doesn't mention all of the work that our staff is always doing with folks at the program level. First of all, the county led by Commissioner Loachman launched a community engagement initiative. This is something that a lot of us have been excited about it. The way that they are approaching the work aligns really closely with what we have presented at BCPH previously. So we're very excited to see that going in the same direction. We think there's a lot of alignment. And we think that having a countywide approach to it is actually going to benefit the work enormously to help keep us on the same page and also to create more support for it. And political will to move into this space. There are a lot of challenges with this kind of work, including things like reconciling values tensions and policy tensions with human resources or legal issues that can go right up against advancing equity. So it's terrific to have a commissioner leading this process. We are conducting a cross-department program review with HHS and Community Services to take a look at food security, mental and behavioral health, and community contracts to see if there's any potential duplication of services and optimize alignment. We expect this study to be complete in another month or so, and we may add some additional areas for review, given some of our funding cliffs and potential deficits in the next couple of years, and just general kind of wanting to tighten up and make sure that we're all in alignment together. The county has launched a space optimization study. Given that we have moved to hybrid work conditions across the county over the last couple of years, there are, I think, some really good questions about how do we use space best. Dr. Gujral will be representing us on that committee. And the expectation is that the study will be complete by around August of this year, with any changes beginning either late in the year or early in 2025. the language access initiative, which is one of the key performance measures for advancing equity at the county level, has recently been launched, and we are very pleased that these county-wide resource pools for translation with contracted providers is being extended to public health. So we have access to those resources, which is terrific for us because we use those services a lot. And have it will be an enormous support for us. As you know, we're aligning the financial system and reporting with the county. I won't say more about that. You know, you've heard a lot about that. The behavioral health roadmap has been approved by the commissioners, as you know, and we're moving into kind of implementation planning. What would this look like on the ground? And we are also, as you know, that's really aligned with our public health improvement plan, which we intentionally designed to fit with behavioral health roadmap. So those pieces of strategic planning are coming together nicely. We are looking at Medicaid billing as a potential new revenue source with HHS, Community Services, and the Sheriff's Office to help with potential for expanded and centralized Medicaid billing to increase our revenues. And we're currently assessing the cost and projected revenues to assess the value of the work. It's kind of a heavy lift administratively and technically, and so we are still trying to determine whether the juice would be worth the squeeze on that one. Our Boulder County Impact Program, I don't know if you all are familiar with it, but it's a partnership of 11 nonprofit and government agencies serving the needs of youth and family who are involved in juvenile justice, child welfare, and or mental health agencies. It's been running since about 1995. It's an award-winning model program that's really about primary prevention, helping kids who are starting to have problems get on the right track and recover a healthy life pathway in a whole lot of different kinds of ways. And it's been, you know, lauded and received all these awards, but times are tight and the state is looking at whether it wants to continue to fund it. It's one of probably the best returns on investment you can make. But that's, you know, that's a hard thing to be persuasive about sometimes. So we are currently looking for opportunities to replace or secure funding going forward. Boulder County Public Health is on the Homeless Solutions for Boulder County Board, and we provide guidance on public health issues such as coordinating outbreak control, harm reduction, and impacts on housing authorities, such as the meth remediation needs. This is one of our groups that we have been coordinating with to try to get a handle on how much meth is impacting our housing authorities. And we also serve in the Boulder County Regional Opioid Council. And those settlement funds have provided over $30 million to the county so far for distribution over the next 17 years to address opioids. In the last year, the council awarded a lot of shovel-ready projects, and now we are moving into a deeper strategic planning phase so that we can create longer-term allotments for more stability and a more coordinated strategic approach to the work.
Are those funds restricted to just opioid programs?
It needs to include opioid work, but it does not have to be
For other substances, right?
Some examples of like the Medicaid billing that you're looking at.
You want to take that one, Indira?
Sure. And Desiree hop in there. So some of our programs have the ability to bill Medicaid, such as immunizations, our Genesis program. And so because they provide those direct services to individuals who are predominantly on Medicaid, the problem has been in the past, the administration to bill for Medicaid really does require a full-time FTE, or it requires a lot of administrative work to be able to do that. So we have some staff who've been with us a long time and they've been able to help keep that moving. But we feel like we're missing out on some revenue generation because of the way the systems are designed. So by partnering with, do you want to add anything before I talk about?
Yeah, I could just add really quickly, right now we have an accountant one that is doing a lot of the admin coverage. So things like giving nurses making sure that all of their information is up to date with the system. is taking a lot of time, so we're coming up with solutions for that. And we're starting to share a little bit of that with the programs as well.
And so some of the challenges are some of the nurses don't have a Medicaid number, so we can't bill for Medicaid, so, and then you have a lot of hourly people. It's challenging, and so the future is that, there is a third-party contractor that's been hired by Housing and Human Services. And so we are looking, maybe tying into that contract to see if we could have a third party help us figure out of all the programs across public health, including ones in environmental health and looking at child's inspections and looking at all these things, lead testing, all kinds of things. Can we build, how do we maximize our billing? And this third party contractor would be able to help us identify them and then figure out how to launch a system to be able to bill and get money returned to the agency. And they're actually pretty reasonable. I think they only charge 10%. So for all the revenue you generate, they only charge 10%. So it's kind of in their best interest to be able to bring in more revenue. I would say the other piece about that is, it's really hard to keep up with all the changes to Medicaid.
You're right. I was gonna say, and the churn, I mean, I was gonna ask, do we know how many of the people who are coming in, for instance, for vaccines are currently enrolled in Medicaid?
Yeah, so our vaccine program is actually a vaccine for children's program. So they're all on Medicaid.
Right, okay.
So we really don't take private pay. We take a few private pay, but we don't accept private insurance or anything like that. Because that was a decision we made a long time ago with the expansion of the Affordable Care Act, which allowed people to go and get their vaccines at, say, Walgreens or Safeway. And even in like this recent outbreak that we're having with meningitis among the unhoused, I would say Carol and Keith, Chris have done a really good job of partnering with Safeway. So when they go in, if the person is on Medicaid, Safeway will actually be able to support people, because the 317 vaccine is only for people who are not insured. And today there aren't that many people who are insured. And so by partnering with them, we can offer the kind of a whole comprehensive. But it's confusing and it's challenging, and we used to have like a dedicated person, and I think through the pandemic, it's just also, it's like kind of rebuilding our systems.
And the reality is that the reimbursement doesn't
Right.
really cover the cost of the staff, but it could help.
Yeah, in some cases you could get reimbursement of like $26 for every shot, but then every additional shot is only like $7, right? So, it just depends, but it does cover at least some of the nurses' time, and administration. Anything to add, Desiree, my partner in crime?
Sure. The only other thing that I thought of, Indira, is the reason that we're all trying to share the same platform is the county is looking to possibly have a person that would be dedicated to Medicaid in the future. So we're looking to have the same processes in case something like that would happen.
That's what I was gonna ask is if you guys could start to share the administrative load outside of the system.
Right, so that's what we're looking at. That's why we're all collaborating to look at this, this vendor.
And then, with like the jail, it's really hard because they don't Medicaid when you're in the jail. But as soon as you leave the jail, and so when we do like medically assisted therapies and things like that, we need the continuity of them getting onto Medicaid right out of the jail so that they can stay on MAT services. Complicated.
Yes. So hard on the people who are seeking care, right?
Yeah. And then with the Medicaid changes, it's been really tough this past year, so.
Is maximizing like the Medicaid workaround. We're doing this.
Yeah, so we, Keith Rawls, who's our immunization coordinator, actually did a lot of research. LPHAs, local public health agencies, to figure out what they were doing, and most of them use a third party. And the other thing is, if you have a Title 10 clinic, in your local public health agency, then you have an EMR, an electronic medical record system, then it's much easier to bill Medicaid through the EMR. But because we don't have a Title X clinic, we don't have an EMR, it makes it more a little way too much.
Questions from members?
That was the one I wanted to know about as well, so appreciate Amber.
I mean, it just, overall reflection it's great to see all the coordination in the county, and it certainly offers economies of scale when we can partner, especially on the administrative pieces, but program alignment and the language access is huge. All these things it's great, and thanks for continuing to join with colleagues across the county to make all of our work stronger.
Just a bit of the hidden work that is always going on.
Great. I mean, obviously you're sharing this publicly here, but in the end, is there going to be some sort of like executive summary or something? I know the county commissioners are wanting us to be doing this work. How is it that we're communicating that?
I don't know if they have something like that planned. These are kind of just initiatives in progress.
There are no expectations set in terms of what they're looking for ultimately out of this collaboration.
This is just business as usual, Boulder County Public Health being part of the department heads meetings and the monthly meetings with elected officials and department heads. It's always going on in the background, and I just wanted to lift the curtain back a little bit for you all to know that these things, are continually happening, and just give you a little bit of a snapshot of kind of the stuff that we're working on currently.
Yeah,
It's not new.
and I'm anticipating we will get updates as community engagement work emerges, right? So the details around that, and it would be great to hear back as you wrap up the cross-department program overview to see what shifts are coming out of that, if there are. So those are a couple of examples of, expect we will hear updates, but if that wasn't on the radar, please do give us an update.
No, it is.
All right, great. Any other questions from board members? Okay, let's see, item number 8, director's report.
So just a few highlights. In the next week or so, you will each get a copy of our draft 22-23 roadmap report. Any comments that you'd like to make, and we'll bring back the finalized version in March for your approval. We will, in the next month or so, be working on the 24-25 roadmap. And the reason that it's taking us a little bit longer is we really want to make sure that the alignment with the strategic plan is there. And some of these other kind of emerging issues, including things like any significant budget shifts that we see. The strategic plan, we are currently working on some updates and changes to the draft version, and we hope to be able to bring that back to you in the next couple of months with some improvements. In terms of communicable diseases, we are continuing to see epi case and outbreak investigations increase, even exclusive of COVID. It is just a rising trend. It was always predicted with climate change, but we are seeing it even in places that don't feel like they're associated with climate change, and part of that may be due just to public awareness of how to report those things more these days. We did recently have a meningococcal disease outbreak in Denver, and we had a Boulder County response that Indira alluded to a few minutes ago, where we were giving shots to folks. We have heard in the last few days that there's an mpox outbreak in Denver, and our respiratory diseases, flu, COVID, and RSV seem to be on the downswing. We are really excited to celebrate the mobile home park ownership work that Rachel Arndt led for the HHS ARPA initiative. I think what's really exciting about it was such a great demonstration of someone's efforts that started with community engagement and went to community power building and then went to policy change, and really kind of came all the way around full circle, just to prove you can do it. You can do it. And the admin and finance refresh is beginning to roll out. We've already had a couple of sessions on 2 of the 9 topics and continue to do that over the next couple of months. And finally, just wanted to celebrate a little bit that our nurse family partnership enrolled 96% of their eligible referrals, which I think is a great accomplishment.
Any questions from board members about the expanded director's report?
Lexi, just the first bullet on under communicable diseases, is that, can you just talk a little bit more about, are there trends that we're starting to see, or is it just more of a note that?
Yeah.
Yeah.
I see Carol's on the call, so Carol, I know that you're there. But Carol did a nice analysis that she looked at kind of the number of outbreaks that we've been seeing, and it's in the director's report. It's about a 20% increase than the 3-year average of what we saw before. And I think that 20% increase is, you know, some of it's attributable to a really high vector season last year. And also, I think she also had in there some enterics as well. But I would defer to Carol because she's really the expert in this area, but I would just say that this is probably not gonna stop, that we're gonna start to see more of those outbreaks, especially with climate shifts and people. Good things.
I remember last year we talked about just whether or not some increase in reporting had to do with strengthened relationships that were developed during COVID, for instance, with early childhood centers where they were, you know, more likely to report than public health.
Exactly, Morgan. This is Carol with the Communicable Disease Program. And yes, we do think that part of the increase in outbreaks, at least, is due to reporting bias shifting towards facilities being more likely to report when they have an outbreak than prior to the pandemic, when we probably had a high level of underreporting from a lot of different places. And there are some places that, like for COVID, for example, we don't have to track COVID outbreaks in K through 12, which was a big bulk of a lot of outbreaks during parts of the pandemic, but we continue to have to report and follow up and do infection prevention in high risk priority facilities like the jail, long-term care facilities, other high risk congregate settings. And so we're seeing just a lot more engagement and reporting in general. And then we think the other increases can be a variety of reasons. I've seen some studies saying that long COVID creates higher susceptibility for certain diseases and conditions. So that could be why we're seeing some more severe things that are happening. Like, for example, group A strep is we had an outbreak of group A strep, and then we had 2 cases of invasive disease, which is a little bit outside of the norm. And yeah, we don't know exactly why, but we're just seeing a lot more situations than before.
Carol, for those extra insights. Any other questions from folks?
I think certainly this will impact the budget, right? Like the needs from this. We have an outlook on what we're expecting. Like % increase in needs overall.
I think it does, because in the communicable disease side, they're coming out of the pandemic. So the ELC 2.1 funding will actually end of April of this year. And then we're using some of our infrastructure and workforce grants to help keep those positions going until the end of the year. But certainly those fiscal cliffs will hit by 2025, which is what we have been anticipating all along. We certainly can't go back to having 2 epidemiologists because that's just not sustainable given the demand of all the cases that have to be investigated. And I will add that, you know, it is in state statute that they have to be investigated. Certainly that outbreaks have to be investigated. And those are, the state keeps adding to the number of report conditions. And then you throw on top of there the meningococcal, the Syria meningitis, you know, that's happening within the unhoused, and the Mpox reemergence. And it's just not, I don't see it going down anytime soon.
sobering update, thank you.
Good time.
Yeah. Yeah,
Middle.
Yeah, and
Kind of
what's
sandwich.
not on here is also we've had significant increases across the state in tuberculosis. And so that's not on there, but the cases are handled by Denver Health or Institute. And then we have a contract with them. Certainly, they're not gonna be able to handle too high of a volume for too. I believe they're asking the legislature with money, short-term, to try to get them through that.
yeah. I mean, it's a good reminder again about, what does the public think of when they think of public health work that we do, and a lot of people do think about epidemiology, and more so even in the last 4 years.
Yes.
This has become part of what the public connects to public health.
Yep, and the team is amazing. Team is absolutely amazing. They have risen to every occasion, every one of these.
I should say the core piece of what we do is response to outbreaks, but also the vaccine part of that, which is trying to prevent.
Yeah.
Outbreaks.
Syphilis not falling underneath here?
Carol, I don't know if you heard that question, but there was a question about syphilis. And I thought.
I did not catch that question. It's been going in and out a little bit, the audio for me.
Question about syphilis.
Yeah, it has been on the rise nationally. We are aware our program does not follow up directly with syphilis. I would say our harm reduction program works closely with Boulder County AIDS Project and other partners to do education and provide prevention supplies and targeted prevention for different groups. But I want to echo what Indira said earlier about we don't have a Title X clinic. I do think we need to look into how those services in general in our community are looking. Maybe, I know we have budget problems right now, so we maybe want to do a landscape analysis, because knowing that with Roe being overturned, we know that our partners at Boulder Valley Health, it's no longer Women's Health, it's Boulder Valley Health, they, I think, are overburdened with providing services to multiple states now that Roe's been overturned in neighboring states. I think they provide services even for people from Texas and 4 other states. So it's something that we need to look at. I think do a landscape analysis to determine if the services for STI prevention in our community are adequate still.
Interested. I know that statewide and in Denver, it's astronomical.
Yes, and it could be that the state takes the syphilis cases because they can be more challenging.
I wonder if that, Carol, the landscape analysis might be something that BCHIP could help facilitate also, the Boulder County Health Improvement Collaborative, just to cut a lot of those folks. So.
That would be excellent. Yeah, that would be excellent. And yes, what Indira said, the state does do disease intervention follow-up with syphilis cases.
All right, last call on director's report. Okay. Thank you, Lexi, for walking us through some highlights. Item 9 is old and new business. Surprise announcements, okay. Always an exciting moment in the meeting. Item 10 is personnel update.
We're actually taking, that's not an executive session. So
Yes, you're right. So we're just gonna continue, right?
Yep, so we're going to adjourn and then.
Yep, okay.
So that's outside of this meeting. So
So
we're,
sorry,
yes.
we are adjourning.
Yes, you're adjourning and then,
Then we're gonna continue,
Yes.
not in executive session.
yeah, everybody else can, everybody
That's fine.
will leave and then the board members will stay with Lexi.
Okay, yeah, great.
Will, if
yes.
Brooke and
Landry.
Landry could hop on the other invite, we'll follow up there.
Okay.
Right now? You want me to switch over right now?
Adjourning.
Okay, all right.
Apologies for being late. I had to drop my son.